This is the brief on inflammatory bowel diseases. Okay, let's talk about Crohn's disease, or CD, and ulcerative colitis, UC. Getting the differences straight between these two big inflammatory bowel diseases is super important, right? It really matters for figuring out what's going on and how to treat it. First up, think about where and how deep the inflammation goes. With UC, it's pretty straightforward continuous inflammation, just in the colon and rectum, and it stays kind of superficial, just the inner lining. Crohn's, though, that's different. It jumps around. We call those skip lesions, and the inflammation goes deep, right through all the layers of the bowel wall. Plus, it can pop up anywhere, literally mouth to anus. Second, the symptoms often tell a story. UC, think bloody diarrhea, and that awful urgency, tenesmus. Pain's usually hanging out on the lower left side. Now, with Crohn's, diarrhea is usually not bloody. Losing weight is a bigger deal, and you often see problems around the anus or pain over on the lower right side. Big clues there. And finally, let's talk long-term risks. For UC, a big worry is colorectal cancer risk, especially the longer you have it and the more widespread it is. It's also strongly tied to PSC, primary sclerosing cholangitis. That's a serious liver duct issue. Crohn's patients, they're more likely dealing with things like obstructions or fistulas. Those are like weird tunnels forming where they shouldn't. So, nail down these key differences in location, symptoms, and risks, and you've got the core distinctions between Crohn's and UC down pat.